So we understand that, again, we touched on ego and pride, but with that being said, there are still a lot of people who do come to a point where they say they need counselling. Even though they do get to that point where they're now sitting with you, they're still probably closed off to some degree. So in what ways do you get them to open up where they're now being vulnerable and sharing, their and sharing their past or experiences with you for you to help them?
It's a process, yeah. And what we have to start with is a therapeutic alliance, and that's basically agreeing to work together, and me using certain approaches to enable them to build trust, yeah. And that's really, really important. And you've got to earn somebody's trust. You can't just expect somebody to trust you just on the first time of meeting. So that's about my skills in terms of building rapport and that quality working relationship. It's about me making space for them to express all their thoughts, feelings in a non-judgmental way, and really allowing them to see my genuine attempt, to do that, and holding that space for them, when they're sharing, and that's where the training comes in, holding that space, because at times, we hear very graphic and distressing things, and the clients can express, lots of tears, anger, emotion, frustration, sometimes aimed at ourselves. It's about holding the space for them and not being triggered ourselves, because it's easy for counter transference to happen where we're feeling something because of what's been said. So the training and our own support structures help us deal with some of those events and difficulties. And every counsellor, every therapist, has a support structure. So anything can be brought in a very safe way. I must say as well is that, I'm a registered, counsellor with the British Association of Counselling and Psychotherapy. And, they have ethical standards, and we adhere to those ethical standards. So it makes the client safe. Yeah, and it makes me safe as well. And these things are discussed. Some of those challenges, or any challenge that arise, are discussed within that framework as well. So we want to essentially, as counsellors, be a holding space, a really supportive, therapeutic holding space for people and their issues.
So are there any common misconceptions that the youth have about mental health?
There are lots. I mean, society is quite uncomfortable with mental health, because once mental health is mentioned, there is this perception that it's on the serious end. Yeah, schizophrenia, for one, psychosis, all types of different psychosis, and people veer away from it because it's quite frightening. It's stigmatized. So when you're talking about mental health, people want to move away from that label as much as possible. Yeah, because what it does, it conjures up certain stereotypes that people may have in relation to you. Yeah. So again, these are misconceptions by other people. So I would say that people need to understand that mental health needs to be seen as in the same kind of bracket as physical health, in terms of, we know when we're feeling unwell, we know when we're struggling with illness and challenges. Yeah, we know when we're thirsty and we dehydrated and, we're unable to get up in the morning, through aches and pain. But it's similar to mental health, in terms of some of those signs and symbols that we're not functioning properly. And just as we seek help or advice with our physical ailments and difficulties and challenges, the same should be looked at in terms of mental health. And I think the stigma prevents people from being open and honest about how they're feeling. And, it's really sad that, with a lot of young people, these feelings or these perceptions are heightened because society doesn't do a good job of explaining what mental health is, what good mental health is, what problematic mental health is, because it's a sliding scale. And, we can drift, from having positive mental health to problematic mental health. And, when we identify that we're slipping towards the other side, it's important then to seek advice. Speak to somebody, who you trust. It could be a friend, it could be a family member, it could be a teacher, it could be a professional, because, it can then help you from moving further along that scale to where it becomes more problematic. So catching it earlier and then speaking about it earlier could have major benefits.
So if you could change one thing about how society views mental health, what would that be?
I would say that I would change the way society presents mental health, not as problematic and abnormal, but something which is part of our day-to-day makeup that we have to work with as we would with our body and our physical health. And that just being able to talk to somebody, to express your frustrations or your challenges with, is part of maintaining good mental health. So I think it needs to be seen with the positive benefits as well as just the negative benefits. I think that's what I'd want to change. So I'd want to see more marketing in that fashion, mainstream marketing, and more open discussion, about it. Things are happening, things are shifting because of the celebrity approach in terms of, their disclosures about struggling with mental health. However, I think within day-to-day family environments and communities, it's still seen as taboo in some quarters and a problem that needs to be dealt with by somebody else. So it needs to be brought back home, and it needs to be seen from just a basic perspective of talking through certain challenges that you have, expressing your thoughts and your feelings, your discomfort, your anxieties, and and it being seen as a healthy way to conduct yourself rather than you're showing your weakness by actually expressing your vulnerabilities. I think it's a cultural shift that needs to happen.
Yeah. Again, back to a point that you mentioned earlier on, it's a matter of perspective, how people are looking at it as well, isn't it?
Yes, absolutely.
Agreed. For anyone who's considering to counsel people on a professional level or maybe on a personal level, i.e. friends and family, what is one piece of vital advice you would give them?
I think the first piece of advice would be get trained. Get trained up to be a counsellor. I think it's a very rewarding career, and you develop the right skills to deliver the right type of therapy with clients in a safe way for yourself as well as the other person. I think in terms of counselling friends and family. I think we all do some form of counselling in some way, shape, or form. But I think, it's about the skills. So I think being a good listener, an effective listener, and also being able to communicate your empathy, your compassion, and your non-judgmental side, in a way that invites the other to share difficult experiences or difficult situations. So being closed off will never enable you to display good counselling skills and get the required response from the client or, a member of family that really needs the help. So I would say, those things are really important. We should always try, if we're offering a safe space, for somebody in challenging, or difficult situations, to hold that space for them, but also recognize when we aren't able to give them what they need or don't have the skills to give them what they need, and to signpost them on to professionals. So don't think that, you have to do everything, or think that you're not able to deliver those skills and those abilities. Just think, is there somebody better who can deliver these skills much better than I can? Because I think ultimately that would be a better outcome for the client or for your loved one who's struggling with certain things.
Yeah, I agree. And some people, they are quite critical of themselves. So they may want to be a counsellor, they may have a genuine passion to want to help, whether it's friends or family or just other people. But because they're not perfect in their own lives, they make mistakes in their own lives, they use that as a way to say, well, I'm not good enough to be a counsellor. So number one is that I believe that's a huge misconception. And number two, what would you say to the person who doesn't believe that they're good enough to be a counsellor? I mean, are counsellors perfect?
Far from it.
Yeah.
Far from it. No, that's a very good question. Counsellors are not perfect. I mean, everybody's going through a journey, and we're still learning. I'm still learning. I'm still dealing with things. It's a healing journey, and there's a term called the wounded healer. Everybody's carrying some form of wound, from the past. And I think the journey of counselling and therapy enables us to have deeper, greater insight into our own wounds, and to be in a process of healing those wounds. And I think it's really important for people to understand that we're never going to be perfect. We're always going to be affected or triggered by something that's happening in our families. I mean, we might go through bereavement or difficult times. So it's really important to know that if it is a calling, if it's something that you want to do, and you feel that it's a right career for you, do it. There are introductory days in terms of courses, and there's different stages. And try it. If there's a calling for it, a genuine calling, try it.
Yeah. In the realms of mental health, especially concerning men, what does a healthy mind look like?
A healthy mind, to me, in my opinion, is one that is able to deal with the day-to-day challenges of life, is able to manage itself and regulate itself when things aren't working right, and able to display different forms of emotions in ways that don't lead to distorted, dysfunctional, problematic behavior. Yeah. So it's one that is self-regulated, but also conscious of the different challenges, but having its ability to be able to identify and rebalance things when things are slightly out of kilter.
Nice, brilliant. Do you have like a top book that you would highly recommend for men?
There's quite a few, but I think the one that had a profound impact on me was a book called Manhood by Steve Biddulph. A really, really important book, I think, that every man, should read. Yes.
What would you say was like the key takeaway in that book?
It talks about the developmental stages of manhood, but also some of the challenges, similar to what we discussed already today in terms of the man box, and the difficulties in expressing our vulnerabilities, our fears, anxieties, and what good examples are and what bad examples are, and how we could all move to a better place, perception of manhood, by being accepting of the wide variety of masculine expressions and lived experiences. So I found that really helpful in my own personal journey, and I do recommend it to others as well.
Okay, brilliant. Thank you for that. Thank you. So we have one final question, which is scenario based. We have a young person who feels lost, overwhelmed by their emotions, and unsure about where to turn for help. They might be struggling with feelings of anxiety, sadness, or confusion, and they're hesitant to reach out for support because they fear judgment or don't believe things can get any better. If you had just 1 minute to connect with them and spark hope, what words of encouragement would you share to help them feel understood and empowered to take that first step towards seeking help?
I would say that, yes, things seem pretty difficult right now, and that I can understand that it feels that it's difficult or impossible to get through. But I want them to know that no matter how small or big the problem is, it can be worked through. And there's strength, in coming forward and speaking about these issues. It's a sign of strength, not weakness, to speak to somebody. So find a trusted friend, family member, or a professional, and speak to them. That's the first step. That's the first step in changing, the issue that you face, and moving on to a much better, happier, existence.
Perfect. Thank you. Thank you for that. Really helpful. Well, Roy, it's been a pleasure speaking with you. You shared so much wisdom and insight, and I'm sure you're going to be changing the lives of many, many more men, older men, younger men as well. And I really appreciate the time you spent with me. So thank you a lot for your time.
Thank you very much.
It's been a pleasure. Thank you.